This is the history of Mary Breckinridge, the founder of the Frontier Nursing Service in Kentucky. Mary Breckinridge was born in Memphis, Tennessee on February 17, 1881, to Catherine Carson and Clifton Rhodes Breckinridge. She was the oldest of 4 children and lived a very privileged life. Her grandfather, John Campbell Breckinridge, was vice president for James Buchanan. Mary's father served as a representative for Arkansas and represented the United States as a minister in Russia. Seen here are images of her father and grandfather. Due to this way of life, Mary has a fantastic education from a very young age. She had many private tutors throughout her youth. In 1896, she attended Rosemont de Lacy School in Lausanne, Switzerland. In 1898, she returned to the States to attend Lowen-Hay Wood School in Stamford, Connecticut. She then graduated from there in 1899. This image shows what a classroom in Rosemont de Lacy School may have looked like. In 1904, Mary married her first husband, Henry Ruffiner Morrison. Unfortunately, just 2 years after their marriage, Henry passed away due to appendicitis. This incident pushed Mary to pursue a career in the field of nursing. In 1907, Mary attended St. Luke's Hospital School of Nursing in New York City. She graduated in 1910 and remarried to Richard Ryan Thompson in 1912. Richard was president of St. Luke's Hospital School of Nursing. Following her marriage, Mary taught French and hygiene at Crescent College and Conservatory for Young Women in Eureka Springs, Arkansas for 2 years. She retired in 1914 to settle down and start a family of her own. Mary gave birth to her son Clifton in 1914 and her daughter Polly in 1916. Unfortunately, her daughter passed away shortly after her birth, and her son passed away due to an intestinal infection in 1918 at the age of 4. This may have also pushed Mary to pursue a career in midwifery. Following her son's death, Mary left her husband to volunteer as a nurse during World War I. Reasons for this may include Mary's grief for her late children and her husband's unfaithfulness. In 1920, Mary officially divorced her husband and took the maiden name of Mary Breckinridge. After her service in World War I, she served as a public health nurse in Washington, D.C. to help patients affected by the flu epidemic. In Mary's autobiography, she wrote, quote, "The head nurse of my area fell ill soon after I reported for duty, so that I was plunged into the direction of nursing care for thousands and thousands of stricken people. I don't recall how many patients we had in my district at the peak of the epidemic, but it could not have been less than 40,000. Nor do I remember how many nurses I had." End quote. In late 1918, Mary and her team of 5 nurses traveled to France to aid the American Committee of Devastated France. Through this, Mary was able to provide the people of France with basic necessities such as food, clothing, bedding, and other household items. She also had goods delivered to war-stricken families in rural parts of France. Mary returned to Kentucky in 1921 to continue her work as a nurse. Mary decided to continue her education by taking classes at Teachers College of Columbia University in New York City. Her goal in this was to gain knowledge on the advancements in medicine. In 1923, Mary traveled to England to learn midwifery. She gained much of this knowledge from her time studying at British hospitals for mothers and babies in the Woolwich district of London. Following her graduation, Mary traveled in the nursing stations throughout the Scottish Highlands and in the Inner and Outer Hebrides to gain experience and knowledge on rural nursing before coming back to Kentucky. In addition to this, in 1924, Mary went to the School of York Road General Lying-in Hospital in London. Her postgraduate schools can be seen pictured here. In 1925, Mary made her final return to Kentucky. She moved to Leslie County, Kentucky, and used the money from her mother's inheritance to establish and fund the Frontier Nursing Service. She focused this care on prenatal and early childhood care. Mary chose to provide health care to the region of Appalachia because it was medically underserved, an extremely poor area, and she had personal ties to the South. She also wanted to prove that if mobile health care was possible in the rough terrain of the mountains, then it was possible anywhere. While in Kentucky, Mary also provided education to midwives. Her service was able to drop the maternal death rate by 2/3. This statistic was provided by her cousin in a documentary on the FNS. These numbers may be considered inflated. Mary and her team of nurses would travel by horseback to their patients. They did this due to the terrain being extremely rough. There were very few roads, and horse trails were the main connection to get from place to place. On horseback, Mary and her team would have everything they needed packed in saddlebags. Patients were never turned away, no matter what their financial situation may be. During the beginning of the FNS, Mary had nurses sent to Britain to receive their training. Due to the rising tensions of World War II, nurses were unable to receive education across the sea. So Mary opened the Graduate School of Midwifery for these nurses to gain proper education on midwifery in the States. This college is still open today under the name of Frontier Nursing University. In 1952, Mary published an autobiography titled Wide Neighborhoods: The Story of Frontier Nursing. The money she received from this book was used to continue to fund the FNS. On May 16, 1965, Mary passed away in High, Kentucky. She worked with the FNS until the day she died. In Mary's honor, the Mary Breckinridge Hospital was built in 1972. This hospital took on the duties of Hayden Hospital, which was then converted into the Frontier School of Midwifery and Family Nursing. In 1982, Mary was inducted into the American Nurses Association Hall of Fame. In 1998, Mary was honored on a United States postage stamp. This can be seen pictured here. Mary Breckinridge had an enormous impact on midwifery and its education, as well as the healthcare in the rural parts of America. Her influence can still be seen today.